Good afternoon. I'm Lieutenant Joseph Nosalik, Assistant Public Information Officer for Kenosha County's Emergency Management Joint Information Center. The Kenosha County Emergency Management Joint Information Center has implemented an additional question and answer program to help address some frequently asked questions from the public we serve. Questions can be sent to COVID-19@kenoshacounty.org. Our plan is to select the top 10 most frequently asked questions from the week and provide you with answers for those questions, or provide you with official web resource pages to obtain the answers you are looking for. The JIC will not provide medical diagnosis or provide legal advice. If you have questions regarding the welfare of a person that you are unable to check on yourself, please contact your local law enforcement agency. The COVID-19 KenoshaCounty.org website is not monitored 24/7, and it is not intended to replace traditional requests for law enforcement or emergency services. That being said, let's begin our questions and answers. I'm joined today by Liane Blanck, who's out in the audience. Liane is our Emergency Management's Public Information Representative from the Kenosha County Division of Health Services. Liane, we've received several interesting questions from COVID-19 at KenoshaCounty.org. Most of these questions will be best answered by a health department representative. But before I turn it over to you, there are two very frequent questions that law enforcement can answer. Number one, is there a curfew? There is no COVID-19 related curfew established by Governor Evers' Safer at Home order to Wisconsin. Both the Kenosha County and the City of Kenosha do have long-standing ordinances that address curfews for people under the age of 18 years old. These ordinances have not changed and are still in effect within their respective jurisdictions. Number two, are car dealerships allowed to be open under Governor Evers' Safer at Home order? The answer to that is yes. Under Governor Evers' Emergency Order Number 12, which is the Safer at Home order, specifically under item number 13, letter K, states that gas stations and businesses needed for transportation are allowed to operate. Directly quoted from the Safer at Home order, all entities described in this section shall meet social distancing requirements between all individuals on the premises to the extent possible. Essential businesses and operations shall, to the greatest extent possible, use technology to avoid meeting in person, including virtual meetings, teleconferences, and remote work. Governor Evers' Safer at Home order can be found at the following website. And there is a third question. Can I still drive to the lake to watch the sunrise? The answer to that is yes. Enjoy the outdoors. Exercise. Work on being healthy. Both the county and city governments have noticed that the social distancing guidelines and Safer at Home order are being followed. We thank you and we ask you to continue to put the social distance guideline and the governor's order into practice. With that, I'll turn it over to Liane.
Thank you, Lieutenant Nosalik. I'm Liane Blanck, the Public Information Officer for the Kenosha Division of Health. And here are the questions that are more health-related. Number one, are there any confirmed cases of COVID-19 in Twin Lakes? We have 24 confirmed cases in Kenosha County. And in following with the Health Information Portability and Accountability Act, also known as HIPAA, we are not sharing specifics on where in the county each case is located due to it being too identifying with our low number of cases. It is community spread, so please continue to practice social distancing and wash your hands. Question number two, is it possible to list the ages of those that test positive and keep an updated list posted in the Kenosha News? I think it will help people who are not taking the stay-at-home request seriously. Ages of those that test positive vary greatly. Our current positive cases range in age from age 7 to 87. More information will be coming soon on an updated website for the Kenosha Division of Health. Question number 3. What are the steps I need to take if I have been exposed to the virus or have symptoms and I do not have a primary care physician? You should reach out to a local emergency department and inform them that you are having symptoms associated with COVID-19. Then they will triage you over the phone and determine if testing is necessary. If they deem testing is necessary, they will instruct you on where you can be tested. If you are experiencing a medical emergency, make sure to call 911 and inform them that you are having symptoms of COVID-19. Always call ahead, stay separated from others, cover your mouth and nose if you suspect COVID-19. You can also contact Kenosha Community Health Center. KHC is working to keep our community healthy during this time and prevent the spread of infection while also offering options for easier access to care. If you have a fever, cough, or other respiratory symptoms, please call the center at 262-383-4091 prior to visiting one of the KHC facilities so you can be screened by one of their providers and directed on what type of visit is appropriate, either phone, video conference, or in person. Question number 4. Is approval needed before I just show up at an ER or drive-through test site? Please call ahead before going to the ER or a drive-through test site. Here is the information on Freightert's Kenosha drive-through testing site. If you are experiencing symptoms and or you believe you may have been exposed to the COVID-19 virus, please call 262-671-7777 for an initial phone evaluation. If indicated, you may make an appointment at their drive-through testing. This is moving on Monday to 6308 8th Avenue. The site will be operational Monday, Wednesday, and Friday from 8 a.m. to 1 p.m. You will be registered and given a date and time for your appointment. You can also go to Aurora's site at aah.org/COVID-19 and walk through the symptom checker on their site. It will walk you through simple steps and provide you with recommended next steps. Local providers are trying to screen their emergency patients by where they have been and with who. It would be nice if you could post travel paths and areas of contact so we could have a better idea of questions to ask our patients. COVID-19 is widely community spread at this point, and any travel is not recommended. For the best information on saturation of cases state and nationwide, please follow up with DHS and CDC websites. Question number 6. When it's spoken Kenosha County, where is the true location? Kenosha County includes the city of Kenosha, villages of Bristol, Paddock Lake, Pleasant Prairie, Trever, Wilmont, Salem Lakes, Summers, and Twin Lakes, plus the towns of Brighton, Paris, Randall, Summers, and Wheatland. Question 7. I have read that pneumonia can be one of the serious complications in those who contract COVID-19. I was wondering whether there was any difference in symptoms or outcomes between COVID-19 patients who had previously received the pneumococcal vaccine and COVID-19 patients who had not previously received the pneumococcal vaccine, also known as the flu vaccine. According to the World Health Organization, no. Vaccines against pneumonia, such as pneumococcal vaccine and the Haemophilus vaccine type B, Hib vaccine, do not protect against the new coronavirus. The virus is so new and so different that it needs its own vaccine. Researchers are trying to develop a vaccine against COVID-19, and the World Health Organization is supporting their efforts. Although these vaccines are not effective against COVID-19, vaccine against respiratory illnesses is highly recommended to protect your health. Thank you.